I could probably talk for hours on Botox, and I know I could. There are too many things to talk about. I've already shot tons of videos on Botox, very passionate about Botox. But I want to focus on a few key points, and these are based on a lot of things I hear patients tell me that I want to really clarify when they mention this. And I hope it will give you a better understanding about my philosophy of why I think Botox is absolutely so powerful. So I'm going to start with this roller coaster design. What this is showing you here is that Botox done over time gets better and better and better. And I sort of think of it this way. If you take two twins who are, one is doing Botox, one is not, I'm talking about just for wrinkles, nothing else. Over time, if that twin does a few rounds of Botox, they look so much younger than this twin that this twin gets worse and worse and worse on the wrinkle scale. This one gets so much better that in order for that twin over time to get past to where that other twin is, it has to go back in the direction of tissue damage, whereas this twin gets worse and worse and worse. And that delta is because as we get older, we only have two options for wrinkles. They either get worse and worse and worse, or they get dramatically better, as this is showing you, in a matter of a year or two, where I've seen patients during the pandemic, they come back, they don't even need much Botox because they look so good. And that's the power of long-term healing. So I want to move patients away from the concepts of waste to the concepts of investment. We're going to explore more concepts of waste and more concepts of investment. We're right now talking about investment. So think of the Botox as either going one way, moving in this direction, or the other way. What I hear from patients, oh, Botox only lasts 3 months. Oh, Botox is a waste because it's going to go away. Well, I'm going to talk about some of the stupid things people do in terms of waste so they understand why I want to change your mindset about this. So this is an example of a lady that started Botox at 61, and if you look at her texture and pores and tone and wrinkles, this is shown 2 years after her last Botox session. In other words, she did a year and a half with me every 3 months, and then at 60, she stopped for 2 years, came back 2 years later with no other skin interventions. You see that even though she may have aged over that period of time, her wrinkles have not come back. Her pores, texture, tone, and quality of skin have not come back in terms of the problems, and it still looks great. An example of imbalance is a photo I use all the time. And if you look at her, I saw this in the newspaper, her forehead looks too perfect. If you think about where the worst wrinkles sit, they sit up in the forehead. But not only does she have no wrinkles there, but her skin, pores, texture, tone do not match the rest of her face. That's the power of good Botox. It's great and it's bad because there's an imbalance there. So that's a powerful investment. But if she came to me, I would be doing the meso Botox. If you don't know what that is, I've shot a 25-minute video on that to have you understand the power of progressive skin healing. So patients always talk about Botox being poisonous and temporary. I replace those words with healing and permanence. Now, permanent doesn't mean that you never need Botox again, but the power of long-term Botox is absolutely incredible in terms of skin healing. So when I talk about waste, we have to first understand what people come in for Botox. In order to understand why people, I think, they're trying to get brow lifts with Botox and fix perfect symmetry, are really wasting their money, we first have to understand the anatomy. So let's do an anatomy lesson here. So this is the orbicularis muscle right here. The orbicularis muscle pulls down. So these two muscles pull down. So when you block this muscle, you get a brow lift, okay? You get an elevation. So that's what people are talking about, the brow lift. This muscle here is called the procerus. This muscle, when you don't see it too well illustrated in this diagram, is called the corrugator. The corrugator is what causes vertical lines. The procerus is what causes horizontal lines. And these two muscles I block in tandem. What that does, these muscles pull down. Think about a frown. When you frown, it creases. When I block a pull down muscle, this also elevates. So these are all ways to create brow elevation. The forehead wrinkles, these are the wrinkles that symbolizes in my black lines. When you block the forehead, that's an elevator, okay? That means there will be a drop. So if you only block the forehead drops. So this looks like a bad football diagram here, but essentially drawing it here, if we block the pull down muscles and leave the forehead relatively intact, then the brows will come up, okay? If I block only this muscle and these are only in play, they'll go down. So let's have you understand why I don't like Botox brow lift. So if you really want to understand why, you have to understand that an eyelid procedure, a small one in the office, or fat grafting are the ways that I really create durability. Because when the eyelid deflates and you're trying to hold it with Botox, that only lasts 2 to 3 months. That means you need Botox every 2 to 3 months to keep your eyes in position. To me, that's a waste of money. It's something that it fluctuates. I barely can hold it in position. So when you're trying to use Botox to elevate your brows, oftentimes I don't think it's really doing that much, first of all. Second of all, it's short-lived. And remember what I said, the opposite of what I showed you. Remember that roller coaster where the more you do, the better it gets, the less you need? It's the exact opposite when it comes to Botox brow elevation, because you need to do it every 2 to 3 months. And once you miss a dose, your brows collapse. And to me, that's stupid, okay? The other problem with it is the forehead. So let's clear this. Let me see if I'm gonna just close it and do it again. So here's the other problem. So if you do that, it means I can't do your forehead. If I treat your forehead, the problem is the brows will fall. That means I've got to leave these wrinkles here. And I think that's stupid. Or what you see walking around town that makes me nauseous are these weird little wrinkles that show up right here because the doctor was too scared to inject it. They usually inject it in a V pattern, so they leave this area out and you get these weird little peaks. I'm not talking any politics, Democrat or Republican, but the thing that's as seared in my brain is the Joe Biden debate when he was vice president eons ago, and he had these devil peaks because he had these weird lines because his Botox didn't go out to this area. So I put a little bit out here, but if you want your brows elevated, you've got to leave this area alone, so then you look like a freak. It's not good, okay? And then you leave wrinkles behind. You need to create a balanced result. So what is balanced Botox? What does that mean? It means that your net down and your net up are not exactly way off, okay? And that's what I don't like, to just treat the crow's feet or just treat this area or just treat your forehead. I like a little bit of multiple zones so there's a net balance. And that balance also, if you do it too consistently and you don't treat this area with Botox, you've got a lot of sun damage, that also causes an imbalance. And that becomes a problem. And we've talked a little bit about that in other videos. But that's why I don't try to just create a brow lift, because long term it's a detriment. For a short term, what you conceive as a benefit, it actually looks weird and fake. So I don't like that. Here's another thing. People do it for symmetry. Listen to my video about left versus right brain. Symmetry is irrelevant unless you have, for example, Bell's palsy, which is one of the reasons I use Botox to treat it. But symmetry is overrated, and I always say the two sides are not the same and can never be made the same. That's the first lesson. The second thing is, why don't I try to treat symmetry? Let's think about it. Okay, I'm going to try to explain this again. Hopefully using this diagram won't make some sense. So let's say this brow is lower. Okay, oftentimes the lower brow has more wrinkles. I've noticed this pattern. So then what you try to do with this is you say, well, I want this to go higher. Well, how do we do this? If you know the anatomy, which we've already explained, is I have to do more blockade higher in this one, and I've got to skip this area. Otherwise, the brow won't elevate. Well, that's well and good. However, here's the problem. Because this brow is lower and it has an overdynamic emphasis on the wrinkles up here, you can't block those. And if you don't block those, they become more exaggerated. So these lines look even weirder. So to compensate for symmetry only lasts 2 to 3 months, which again is a waste. And in addition to that, sometimes I've got to play which is more important? So if the brow is lower and you've got excessive wrinkles here, and I try to give you nothing up here to give you the brow elevation to hold it in place for 2 to 3 months, and then you look weird because you're peaking on the side that has the more wrinkles that's lower down, it doesn't look good. And so this is the art of creating balance. And yes, none of you understand this. This is why people go down the street to get the cheapest Botox they can. They don't understand any of these things. They just want to get it, whatever. I had a funny story to a gentleman from Turtle Creek say, hey, you know what? Dr. Lam, how much do you charge per unit? And I said, well, I calculate, okay, whatever. I don't even charge for it. I charge for a result. And I figured out whatever. And he goes, Dr. Lam, you charge me $200 more for half the units I'm getting down the street? And I said, well, which looks better? Yours. Which lasts longer? Well, yours. So wait a second, but Dr. Lam, how does yours last longer when you're using half the units? I said, because I place them well. It's not the units you're paying for. It is the distribution of those units, an effective way to last longer. And he goes, well, I don't understand why Botox is just not Botox. I said, well, you're a violinist. I don't understand why you're just stringing something across the thing, right? You're not thinking about what you're doing. It's all the same, of course, I was being facetious, because I love good music, but I think it's a funny story to have you understand it's not just Botox to me. If this is being shuffled off, like I do very good facelifts, fat grafts, eyelid surgeries, but I care about your Botox, because if I do a wonderful rhinoplasty and eyelid surgery and someone does some crappy, pardon my French here, I speak French as well, so that's not really French, but a bad Botox for you, the net result is you look weird and it's a waste of money. I need you to understand the benefits of this. So to show you really the power of this too, I'm going to finish with one more concept that I think is powerful in illustrating a long format. What I mean a long format is not being rushed by a TikTok video where I've got 59 seconds to say it. This is a lady here that we've talked about in other shorter videos where you look at her. I've done a facelift, fat graft, upper lower eyelid for her. So I've done the surgical elements, but I still need to address the skin. So if you look at her skin, it looks so much cleaner. So what I did for her is I did 3 rounds of full facial Botox. Now here's what's interesting. She's been doing years of Botox by someone else. This is when she came in to do Botox. In other words, the Botox is faded. There are wrinkles there when she moves her face, but look at the skin healing I've done in 3 rounds versus years of someone else's Botox. People do not understand the power of long-term healing with Botox because they get crappy, cheap Botox. Look at the quality of skin, because this no one even in Texas does, is I'm restructuring the entire skin using Botox. It looks like I've lasered her. There was no, okay, well, there was a laser just under the eyes, but there was no laser in all this. And then when you look at her smiling, this is a dynamic balance where I'm doing not Botox, I'm using a cross-hatching filler. You should listen to my video I shot last week, a 15-minute video about dynamic fillers to understand how to match that. Because another imbalance when we're talking about it, you know that when the crow's feet comes out a little bit too far, your Botox sucks. Even in my hands, I can't nail those wrinkles. So I'm using a filler, using a dynamic cross-hatching filler. Listen to my video on dynamic fillers. I'm not going to go through a 15-minute lecture just about that. It's not about adding volume. It's about creating balance on that skin. So this is the problem, is when you've got what I call grade 3 wrinkles that go beyond the orbital rim, you simply cannot knock out those wrinkles with just normal Botox. You need to use some fillers to manage it. And so what is the real long-term consequence? So this is the problem. This is what's interesting, is this photo was used on a blog. And if you look at her, what you're seeing is that even though these are not bad, you can see that there are deep wrinkles here. They don't match. And what Botox does is it tries to balance those components so that you don't get just a static imbalance where the lower face looks so much more aged from a porous texture tone. I use that Botox to fix the static problems, but I also use the fillers to manage the dynamic problems to create better balance. You say, well, give me a long-term plan on this, Dr. Lam. I'm not made of money. I can't just blow cash here or there, tell me to spend all there. You know, how am I going to do this? So I jokingly call myself a Botox personal trainer and a facial financial advisor, both of which I've shot videos on. So what does that mean? It means I want to spend your money wisely. Here's a simple way to understand it, to make it very easy. And I will help guide you and tell you, look, this is where I'd spend the money. This is a bonus. Don't worry about this for a year. If you're Botox naive, which naive doesn't mean you're stupid, it means that you just never have done Botox, is the term that we physicians use. So if you're Botox naive and you really haven't done Botox, you will have much worse texture, pores, tone, wrinkles, quality skin in your upper face. Start with that. That's what I call low-hanging fruit. Listen to my video on low-hanging fruit. But essentially it means it's easy. Start with that. Don't worry about all those other things I told you. Just get consistent. Get a few rounds under your belt so I can start progressively healing your skin. What is this lower face Botox? It's for people that don't have a lot of wrinkles up here. I just today saw a 35-year-old lady. I just did her eyelids a week ago. Shockingly, she really didn't have a lot of wrinkles up there. She had sun damage, and really she had more advanced lines here, and that's pretty unusual. So I told her, look, to be honest with you, I don't need every 3 months here. We just may need a couple rounds up here. Not even consistently, but I want to work on a pores, texture, tone. So I will tailor it to the problem. So for example, if you've just got deep wrinkles and that's all I see, I may just say, hey, let's focus on the fillers to manage that. If you've got deep wrinkles here to start, I would say, and that's the majority, we start on this. But if you are someone that's had done Botox for 8 to 10 years, even if like that last lead I showed you where it wasn't that great, but it wasn't that bad, I need to start getting this balance. I need to start working on this to catch it up. It's sort of like going to the gym and you see these guys with massive biceps, they have poor triceps, they got these tiny little legs. That's an imbalance. By the way, to help you learn something, I just finished my 9th hair book and I've written my 12th or 13th textbook, and I learned unbalance means like I'm wobbly. Imbalance means there's components that don't look balanced like this. So this is an imbalance, not an unbalance, a term that I misused in the past, but it's an imbalance when it comes to facial features. So that's some general principles about Botox. I could spend hours talking about. In fact, look at all my other videos on Botox. I'm very passionate about Botox, very passionate about everything I do. But hopefully this will give you an understanding of how Botox should be balanced. It should be an investment. It should not try to do these things that are just a waste of money, and give you a better understanding of how to approach your physician if they get it. They probably won't get to the level I get. Or if you're a prospective patient, I want you to understand my philosophy and strategy.